Well, obviously, in the brief time left, I've got to try and so make it very succinct. And basically, for people who do not have any varicose vein problems or any chronic venous insufficiency issues, then basically what they need to do is just, basically try and walk around the house, around the garden, or walk around the area outside, and try and so make it as often as you can. So in other words, if every hour on the hour, or even better, every half hour on the half hour, you literally get up and walk around and have a drink of water, or just go to wash your hands or whatever. So 2 minutes every half hour or hour, that is really extremely good. Why? Because it will actually reduce the pressure in the veins as you sit. So when you sit in certain areas for a very long time, usually 4 to 6 hours, then you're going to get problems with distension of those veins. Now, for people who have more symptoms, in other words, they have actually elements of vein incompetence and chronic venous insufficiency, what I think they should do is try and invest in some stockings. And the best stockings to invest in, as a general rule, are the 20-30 compression up to the knee. But they need to make sure that they actually fit properly. Now, those will be protective, not 100%, nothing is protective 100%, but they would help a lot in reducing deep venous thrombosis, which is clots in the deep system, which I hope next time we will be able to discuss that, because that is extremely important, especially as people sit at home. So that is important to do, to wear the stockings, and in addition to try and exercise a bit. Exercise doesn't have to be vigorous. You can just walk around, and as I said, try and make it every half hour to 1 hour. Get up and walk for a couple of minutes. That should be enough to move the stagnant blood in your legs and stop the distension of the veins. Because as the muscles contract, they're going to squeeze those veins and, of course, push the blood up. And if you're wearing stockings, even better. If you're not, it's still good. And when you're sitting for very long periods of time and you cannot get up for any reason, then try and sort of elevate your feet.
Okay, well, thank you for that very important advice. And I look forward to having further conversations, and we'll be having these once a week on various topics, and encourage people to engage with us, to share your questions with us. And we look forward to seeing you again next week, Dr. Burmata.
Thank you very much. I hope we can talk more next week.